Hello, my name is Joseph Leung. I'm currently the Mr. and Mrs. C.W. Law Professor of Medicine at the University of California, Davis School of Medicine. I am also the Chief of Gastroenterology for the VA Northern California Healthcare System based at the Sacramento VA Medical Center. Today, I'm going to discuss with you regarding the manuscript that is coming out in GIE endoscopy, a randomized controlled trial to confirm the beneficial effects of the water method of U.S. veterans undergoing colonoscopy with the option of on-demand sedation. We want to address two issues related to the use of colonoscopy for colorectal cancer screening. The first issue is to emphasize patient-centered care, where the patient controls the use of sedation medication based on their need and the perception of discomfort, rather than to have medication use dictated by the colonoscopists or by the nurses. We call this on-demand sedation by the patients. An earlier study report suggested that doctors and nurses were less accurate than the patient in gauging the amount of discomfort during colonoscopy. The second issue is to document the recovery time burden involved in screening colonoscopy performed with different methods and whether sedation is actually used or not. These included the time spent by the patient in the recovery room on-site, as well as recovering at home. A prior observational study indicated that the patients need to spend up to 45 minutes in recovery on site and a median of 17 hours recovering at home if they underwent sedated colonoscopy. We postulate that a less burdensome alternative in the long run will be more appreciated or acceptable to the patient. But how to find a less burdensome approach which should also be inexpensive has not been studied in this country.
What does your study add to existing knowledge?
First of all, completion of colonoscopy without sedation is possible if we let the patient decide when medication is needed. The approach minimizes the recovery time burden on patients and does not cost anything extra. Just simply let the patient decide. Secondly, many more patients were able to complete colonoscopy without sedation in the group examined by the novel water method. The results confirm the water method produces significantly less pain during colonoscopy. Therefore, the take-home message is that the combination of the water method and on-demand sedation is an effective and inexpensive way to minimize patient recovery time burdens. It literally costing nothing.
What should come next?
The reader should consider giving this combination a try. It does not cost anything extra, and the recovery room nurses will be happy to see a lighter workload. Me and my collaborators will help anyone interested to get started. Please send us an email at jwleung@ucdavis.edu.